Good morning, everybody. This is Dr. Sarvar Pathan from Personalized Physical Therapy and Wellness. I am here live to walk you through the TeleWell experience that we have now introduced since about 2 weeks. We have had a lot of telehealth, telewellness experience for quite some time. And on top of that, we recently with the COVID-19 had to innovate and pivot for ongoing needs for the care that is required in the community. People are still having to, take care of their own health. People are still having to worry about how they're going to manage and maintain during these unusual times when they're stuck inside the home. If the only activities left now is being able to go out and walk or play tennis or play golf and not able to go do your gym or, treatments like that or out to a clinic, this is possible in your own home. And we can design a treatment plan, examine you, and help you get stronger, get better, pain-free, all through a distance. So I'm going to walk you through what all basic things you need, what basic 2 things you need during the whole TeleWell experience, what application do we use and how to access it, how easy is it for you to hop on a video call with us, and what will you experience once you are going through an evaluation. I also have a very nice offer for the people who are watching. Hang on tight and we'll get over to your offer. That way you can take advantage of this offer when we get around to it. So basically, the TeleWell experience, I'm going to start sharing my screen. What you're going to find is we will be using the application called Zoom. So I'm going to go to my Zoom. Basically, what you need to go do is go to Google and just type zoom.us is the Zoom application. Most people with this COVID-19 times, I'm assuming by now you would have the Zoom application because that's supposedly the most popular Zoom application out there. With that said, we also use the Zoom platform because it's very convenient and easy for most people to have access because you have the application on the phone. You have application on the iPad, you can access through laptop. Going into Zoom application is just a Google search away. And if you are using it through iPad or iPhone, you basically go to your app store on your phone and just type Zoom and there will be an application that you can download. Once you are in Zoom, by this time, you would have already received a link from us through an email. That link is something that you will require to join to our video secure call. Once you're in Zoom, you just click on this Zoom. You can probably see my cursor right here. Click on join a meeting, and that link is something that you put in here. Okay, that's one way. That's one of the ways to join in. The other way is once you're in the application, you would want to open your email, and there will be a link. You just click on the link, and your phone will automatically guide you to open that application and start the video call. It'll just kind of walk you through, say, do you want to start the video and start the audio and unmute yourself, and we're on a call like live looking at each other and starting to examine and find out what's going on with your problem. So these are that's the TeleWell experience that you will see on the application. The other beautiful feature that this TeleWell experience allows me to do and goes hand in hand with what I would be able to do in an exam, in-person exam. The share screen option is something that I just did with the Zoom application as I was describing to you and helping. I am able to, let's say, after I have already done the physical examination and going through the condition that you're going through. Let's say if you've experienced back pain, you've got a fairly common condition called the lower cross syndrome. You will see that you will be able to understand what's going on even through the video call because I'll be able to share the screen and explain to you exactly what's going on in your back. So let's just, for example, say, which is a very common condition, you have lower cross syndrome, you may be developing some weakness in the abdominals. We'll be doing some internationally recognized standardized tests to find all of these ailments, weakness in the glute max, tightness in the iliopsoas, which is your hip flexors, and tightness in your lower back. So that in combination becomes your lower cross syndrome condition that you're going through, which is a very reversible condition. It takes about 6 to 8 weeks for you to, start feeling normal, pain-free, back to normal activities. And that's how we were able to like share the screen and kind of go through what is the ailment that you're experiencing. For the evaluation itself, the way we examine, let's say if it was for the neck or shoulder, basically we need 3 different views for you to be examined thoroughly from all different areas that we need to look at. And so as we perform these internationally recognized tests, we look at your posture. So that sitting position allows us to take a look at where your ear lobes are located. Is it side bend one way or the other? How is your side chin bone situated, and how much are we able to see through the posture? Looking at the shoulder height, looking at your neck range of motion if you've got some neck issues going on, looking at arm range of motion, looking at your upper body side to side bending, looking at your rotation of the trunk. And so that's, primarily anterior view. There is a need for looking at the whole body while we're examining. So the best option is that you're able to move the laptop and place it in a position where I am able to see the whole body, and that you can just back up to a point that I can see all of you. And then we're looking at, side bending, trunk rotation, your knee and trunk flexion, your balance. Obviously, safety is important during the balance exam, so you're just kind of holding on to something when you're doing that. Then the next view that we need is the side view. So you're looking at us from the side, and we're examining you while doing these motions. So you're doing the backward bending, the forward bending, hip mobility testing with like the figure of 4 here. And then the last but not the least view that we need, and this can vary depending on what kind of tests and exams do we need, but this is for the laying down position. Now, it doesn't have to be on the floor. It could be on the massage table or a bed that you have, and that you have the camera or the screen just sitting right beside you, and we're able to take a look at what's going on. So arms beside you, and then we're looking at like how is your mobility on your hips, how is your mobility in your internal, external rotation, looking at the other side, how is your discomfort, if there is any pain. Then looking at your hip strength and mobility. We're checking your external rotation strength, your abduction strength, looking at your core strength, holding a plank for a few seconds, see how things are. You switch sides, you lay face down. We examine the legs this way and are able to see all the tightness or discomfort that you may be experiencing during any of those movements. And all of that information gives us an idea about what is going on. As I say quite commonly, is about 70 to 75% of the diagnosis hypothesis is already done by the time we move from getting to know you, just asking you questions about how your pain is, from that to starting of the movement exam. So just listening to you and understanding your symptoms, about 70 to 80% of the time we'll already know what's going on. The tests are designed to just prove that yes, that's what it is, and confirm the hypothesis, or find that, oh, actually that's not the hypothesis what we were anticipating to start with. It's something else going on. And so we're able to like confirm based on your subjective conversation, like when we're talking, and then doing a movement exam to find out, okay, that's the problem going on. Then once you're done, as I said earlier, we'll look at your condition. So, I'll just give another example here of, let's say we found some sciatica symptoms going on. One of your tests were positive, called the straight leg raise test. And in the straight leg raise test, you are laying on the back and you're lifting the leg up, and you have some symptoms going down the leg. So basically what is happening in sciatica is this is the back view of your body, and these are the two big nerves these are supposedly the largest and the thickest nerves that come out of your back, and it supplies the lower part of the leg. So it comes out of your lumbar spine, lower back, and slides down and goes into the leg. we're able to find out how far it goes, what all areas is it affecting, what levels it's affecting, all of those by just a subjective history and physical exam, and find out if it's a pinched nerve, it's a herniated disc. Each of those gives a specific pattern of symptoms. You don't necessarily need an MRI or an X-ray to find what kind of an ailment are you experiencing. Each of them come with a set pattern of symptoms, and that set pattern of symptoms, along with a physical exam, we are able to confirm the diagnosis and design the treatment plan for you. So if it's a disc issue, how much of it is bulging disc, how much of it is affecting the nerve, how much is more of a muscle spasm, how much is it coming from like the inflammation more than like an actual disc bulge, or is it even a sciatica, or is it something else? And all of those comes from the experience, comes from working in the physical therapy field for over 10 years, helping people with back pain and other ailments for a long time. So you get the full experience of the knowledge, the skill, and the accurate diagnosis of what's going on through a video experience, without having to go see someone in a clinic and stay safe and maintain the social distancing that we require at this time. Even without the social distancing time, we have helped a lot of people throughout the state of North Carolina. We have patients in Boone. Our office is located in Winston-Salem. We've got a couple offices here, but this is one of them. And we have patients in Boone. We currently have patients in Oriental, North Carolina, in Durham, North Carolina. We serve quite a lot of people with TeleWell, even without having the COVID-19 situation. We just started to make it more accessible for people to be able to get the experience of TeleWell. In a way now, the other thing I wanted to share with you was how you're able to get the access to the TeleWell service. So you can contact us through a couple ways. So I'm going to share the screen again. One of the best ways you can contact us is through just going to our website, our phone number, or our Facebook page. I'm gonna open up our Facebook page here, and so this is probably would be the regular Facebook that you would go in, and you are just going to search for personalized physical therapy and wellness, and that's our business page. And you go in, and here you will see all the services that are available that we have to offer. And this is, I am the admin to this page, so that's why you have a different view. But what you would see once you search, that this is the front page to our view that you will see. And basically once you're here, if you scroll down, you'll be able to see the services. So these are all the services that we are currently offering during these COVID-19 times. And here's the TeleWell service. So you can just click on it and ask about it to us. So you'll be able to text us or call us through Call Now, or even text us or message us here. The other way is you can just reach out to us through our website, and I'm going to share that screen real quick on the phone number and the website. Here's our website, www.pptaw.com, and this is our phone number. You can contact us here. That's how you can find us and let us know. The big offer that we have for you guys, anyone who's watching our services, we are serving the community at much of a helpful price point right now, knowing the way how the economy and people are being affected. Our services are $140 a visit. For the people who are watching right now, we are doing an offer of evaluation for just $27 a visit. So that's something that you can easily take advantage of. $27, and you'll be able to get a very thorough exam about whatever the ailment you're going through, neck pain, back pain, come with a treatment plan. Oh, something that I forgot to share is you also get the treatment experience and a customized home exercise program that you'll be able to receive to your email or to your text message. Here is our software that we use for home exercises. So let's say after the treatment we found that some of the movements actually help you with your pain and some of the movements irritate. So we will define and design that treatment plan and apply that to your treatment movements. Movement is medicine, and we're going to use that movement to help you decrease your problems, create long-term solutions, give you tips for how to manage the pain using pain management options available, like ice pack, heating pad, kinesia tape, ointments, and bracing, and all what you really need. We'll be able to advise you. Even we'll send you links to different vendors or even Amazon for you to be easily find what the products you need, and then you can easily order it and still get the service that we're talking about. So exercises like this has the pictures, has the text, has the frequency that you need to be doing it at, and we'll be able to send it through email, through text message, and update it as needed during your treatment protocol. All right, feel free to text me or call me if you have any questions, but that's where we conclude. That's your TeleWell experience. You will get it through all of this through your live Zoom video calls, easy access. You just click on the link and you get on started. All right, thank you very much, guys, and it's a pleasure to serve you, and we'll look forward to talking to you and helping you through.